Hello and welcome to Discovering True Health, your weekly deep dive into health and wellness. Thank you so much for joining us today and Happy New Year to you all. Before we get started with today's show, please hit the subscribe button. It helps us out a lot and you'll stay up to date on all our upcoming shows. You can also check out additional information on our website, Instagram, and Facebook. All those links are below. So according to data published by the Association of American Medical Colleges, the U.S. could face a shortage of between 54 and 139,000 physicians by the end of 2033. Now, this data, coupled with the current healthcare crisis that has been going on here in the US for some time now, with cardiovascular disease, cancer, and other major diseases skyrocketing, it's vital that we all take control of our own health and health care. So today on Discovering True Health, we will be learning some practical tools that make the healthcare system more user-friendly, and we'll be learning how we can optimize our own medical care and cut our healthcare costs by learning key elements to expedite our diagnosis and minimize unnecessary tests and procedures that can often be expensive and dangerous. We'll also be learning how we can ensure our own safety while in hospital and how to navigate hospital billing to reduce excess costs and avoid exorbitant bills. So my guest joining me today is Dr. Hester, a board-certified internal medicine physician with over 25 years of patient care experience. She's also author of Patient Empowerment 101, and her book empowers people to become equal partners in their healthcare, and it's full of practical, actionable tips to optimize our healthcare experience by helping us prepare for medical visits in advance. So thank you so much, Dr. Hester, for joining me today.
Thank you for having me.
Now, you are an internal medicine physician with over 25 years of direct patient care experience. And now you've written 2 great books empowering patients. So what was the catalyst in some of your experiences that inspired you to write your books?
I wrote the first book over 20 years ago because I realized that there's a huge void between the way we think and the way patients think. Now, 20-something years ago, patients really didn't care about health empowerment so much. She was like, well, the doctor tells me what to do. I don't need my records. And John Wiley & Son published a book. It was called Your Family Medical Record in Record Guiding U.S. Care. But again, people really didn't care that much about self-empowerment, from a health standpoint at least. And so the book eventually went out of print. And recently, with all the things that have been going on, I just felt that this is the time to try to revive that, because now people are much more interested in caring about their own health care and taking steps to improve their health care. So I took some of the parts I liked most out of that book. I changed it a little bit, and then I added another 20 years of experience. And then I wrote, Patient Empowerment 101, more than a book, it's an adventure. And I published that about 5 weeks ago.
Oh, wow, it's that new. Beautiful. Yeah, I would have to agree. It's definitely important right now that we all are equal partners and really part of, obtaining our own knowledge and working with our healthcare professionals when it comes to our own health. Now, your plan is to transform healthcare as we know it, which I love. It's such an important thing that needs to be done. What would or does this transformed healthcare system look like, and what are some of the major aspects you feel need to be changed and why?
America has had a very paternalistic healthcare system, and it's time for that to change. We go to medical school, we spend a lot of time studying science, and then we go on to medical school and we study medicine, and then we have residency training for years. So we have so much going on as far as our training. Patients don't have a patient school per se. So we know what we want when you come in to see a doctor. You go to see a doctor, your doctor knows the specific things that he or she is looking for that you don't know. It's because nobody's told you those things. So let me give you an example. Your doctor can no longer just charge your insurance company whatever she wants to. Everybody's accountable. We're trying to rein in healthcare costs, and there are national evaluation and management guidelines. And when you see your doctor needs to document a certain amount of information to substantiate paying, the insurance company paying for what is charged. In addition, if doctors bill a certain level and the doctor is audited and did not document enough of this information, the doctor can be charged with insurance fraud. So this is very serious business. Wow. Medicare, other insurance companies, they want to know if they're giving the doctor X amount of dollars for a specific level of coding, that the doctor has quote unquote earned it. And so, for instance, these 8 key elements, they are not just a matter of coding for insurance purposes. They do help doctors hone down the potential diagnoses. And I'm going to go over them. These are really important. I want people to write them down and remember them. The first one is severity. So if you develop a symptom such as pain, be as specific as possible. For women who have children, childbirth would be a 10 over 10 level of pain. For a man, let's say that he broke a leg, that would be a 10 over 10 pain. That is severe. 0 is no pain. And so you go from like 0, 1, all the way up to 10. And so if you say my pain is 5 over 10, that's moderate. That tells the doctor something. If you say, oh, doc, it hurts a lot, that doesn't mean a great deal. I've seen patients who said, I'm having 10 over 10 pain, and they are texting, watching TV, 10 over 10 pain. I'm like, no, sir, that's not 10 over 10 pain. But they just don't know. And so if you consider the severity at a 10 as excruciating, oh my gosh, please get rid of this pain, that helps. Also, note the impact on your activity. If the pain is so severe, you can't work and say, doc, I can't even get out of bed and go to work because the pain is so severe. That is telling the doctor something more than, oh, it hurts a lot. The next is location. A good example is your abdominal cavity. There are organs in the upper left, upper right, lower left, lower right. And so be specific. If you have pain in the upper right abdomen, the doctor might start thinking about your liver or your gallbladder. If you say it's the right lower abdomen, maybe he's going to worry about appendicitis. So instead of saying, I have belly pain, I haven't really noticed where it is, it just hurts all over. If it hurts all over, it hurts all over. But try not to pin down as much as possible the location, and that can help the doctor focus on what it likely is and is not. The duration. How long has it been going on? Such as, you know, doc, I noticed this pain about 3 months ago, or I noticed it for the first time 3 days ago. So the duration of the pain is important. That's a little different from the timing. That's number 4. Each time it occurs, how long does it last? So, doc, I've had this pain for about 3 months off and on. That's the duration. Each time I have it, it lasts for 2 hours. That's the timing. Then we'll get to associated signs and symptoms. If you have abdominal pain, what else have you noticed? Do you have nausea? Have your stools turned black? Some people might not really pay attention to the stools, but if you have abdominal pain, it's important to do so. Unless you have had recent iron or Pepto-Bismol, if your stools turn very black, like black and tarry, that is saying to the doctor, you might be bleeding internally. That's because stomach acid, once it's mixed with blood, turns everything black. So if you vomit up black, gritty, polygon-looking material, your doctor's going to say that person may have an ulcer or some other source of bleeding. If your stool turns black, the doctor may still feel you have the same things going on. But whether it's above or below, that very dark brown, black, tarry looking consistency is telling you doctor something. So pay attention. Pay attention if you have blood or mucus. If you have blood, is the blood in the stool or just a tiny bit when you wipe yourself, which could just be hemorrhoids. The quality is important. If you say, I have this sharp pain, like somebody sticking with the fork, that's somewhat different than I have this squeezing pain, or I have a burning pain. So think about the quality as well. Modifying factors, what makes it better, what makes it worse. If you say, I have this bad headache, 5/10 headache, and I take Tylenol, and 30 minutes later it's gone, that says a lot. If you say, I took a Tylenol every 4 hours, it did nothing, that also tells you doctor's something. So what makes it better, what makes it worse? And then we have the context. So if you say, doctor, I had this excruciating pain start right after I picked up a heavy sofa. Then the doctor is going to say, okay, that's severe back pain. It's probably muscle strain. So the context is also important. So again, the issues are severity, location, duration, timing, associated signs and symptoms, quality, modifying factors, and context. So when you tell your doctor those things, then your doctor's going to be able to document appropriately and will be able to spend less time trying to pull out information, which means the doctor can do a more focused exam, can narrow down the diagnosis, which means fewer unnecessary tests and procedures. And that can help save you money. It can help decrease the frequency with which the doctor orders medication trials to see what may work, what may not work. You can spare your wallet, you can spare your body of chemicals it doesn't need. It is a true win-win. And when you get to the bottom line quicker, then you have those extra few minutes to talk about preventive issues or whatever else you want to talk about. And so it is really important to focus in on those 8 things. That's a good example of when I say transform healthcare, that's exactly what I mean. Patients will have the tools they need to communicate with us on a completely different level so they can help expedite their own care, lower their own bills, and help the healthcare system.
Thank you for sharing those. Yeah, this is so helpful. Because like you said, it's best to be partner, and it sounds like it's this really it's about self-awareness and really kind of understanding what's going on in our own bodies and kind of deep diving and preparing before we go to the doctor and kind of going through these bullet points that you laid out and then presenting that to the doctor so they're not just like, oh, I'm in pain, this hurts. It's we present them with something specific so they can actually kind of go in that direction instead of having this whole mass of, okay, where do I start?
Exactly. And there's something I call OHEC syndrome. So you ask the patient a variety of things. I haven't really paid attention. I'm not sure. I had one patient, I asked her a yes or no question. It took her 10 minutes to answer because she hadn't really thought about it. We're not going to have that kind of time when the visits become very short. So, the doctor is saying, well, it could be appendicitis, could be hepatitis, pancreatitis. It's OHEC syndrome. Oh, heck, I don't know what's going on. Then you want a lot of tests to figure this one out. It's cheap. So a lot of tests are done. It costs a lot of money unnecessarily. And so I really want people to have the tools they need to communicate with us on a level that they never imagined. And doctors are starting to embrace this patient-doctor communication at this time. We're getting away from the paternalistic mandates and realizing the patient experience matters and they need to be front and center in their healthcare.
I love that you said that. It's so important that, nobody knows our bodies the way we personally know our bodies, what we're experiencing. And if we can learn how to communicate that through this process and know exactly what needs to be communicated, sounds like it's going to be extremely helpful in so many ways. Now in your book, you also have questionnaires for 11 common symptoms. How will these questionnaires help us?
So let's go back to abdominal pain. So
Okay.
the questionnaires, for instance, you develop abdominal pain. And so you open the book and you go through the checklist. And so you're basically given the FAQs the doctors want to know about abdominal pain. So you don't sit on the cold table mad that your doctor is late. You need to get back to work with your project. When you walk in the office, you will have thought through all of these things. So you can go through the things that you have had, and the doctor asks you the other things, like, no, because you've already thought about it. You can actually, I made a website. It's patientempowerment101.com. If you have the book, you have the web pages for the inside of the website, where you can go to download all of these symptom questionnaires, the word forms, so they are fillable. You can download it, you can fill it out on your computer, you can save it, you can print it. And so you can do this as many times as you want. You can download as many forms as you want. And so when you go into the doctor's office, you have all of that right in front of you. And also the book is available in Kindle Unlimited is free. But if you get the Kindle version, whether it's free with the unlimited or you pay for the Kindle version, you can have it on your smartphones. You're sitting in a doctor's office, you go to that part and you start going through the symptoms. So it's common ones: abdominal pain, fever, diarrhea, back pain, some of the most common symptoms people have that would make them go to see a doctor. They'll know the frequently asked questions before they even step foot into the doctor's office. So that's
Wow.
the purpose of the questions.
That's incredible. So it will give us for each type of symptom of the like the major ones, it will give us kind of these specific questions to answer that we can just say, here you go. And then they can pinpoint better what's going on.
That 10-minute pause without the doctor asks you a question like my patient had, you will know the answer, because you'll stop and think about it. Just something as simple as the dark stools. Most people don't understand the significance of that. But if you had belly pain and your stools turn dark, like, oh my, that's something I need to focus on. Maybe you'll make an appointment sooner to see the doctor, because that means something.
Right. Now, I mentioned at the top of the show, it's looking from the data that we're going to have a shortage of physicians 2033. In your opinion, what are the factors that are going to contribute to this shortage?
There are multiple things. One, doctors are aging out. As doctors grow older and they retire, there are just not enough doctors who are applying to medical school, getting into medical school and training to really replace them. Then you had the COVID, and a lot of people left, doctors and nurses. And also over this period of time, the population, I think, in America is going to increase, I think 10% or so, but the population over 65 is going to increase much more. And so if you consider the healthcare needs of a 70-year-old versus a 20-year-old, the 70-year-old is going to need more time. And so proportionally speaking, we're going to have more people in their mature years, and they're going to require more services. And we're just not going to be at a place where we can keep up. We can't just turn on the faucet and all of a sudden in 2 years we have enough doctors. It takes time to train. It takes time to get people through medical school and the residency programs. So there will be a deficit of primary care doctors and specialists. So you think that the appointments are short now. Just imagine what it'll be like in the future. And so that's even another reason that you need to be equipped to walk into the doctor's office, go from A to B to C very quickly, help expedite your own diagnoses. And also, if you do that, you're not just helping yourself. If you can get a correct diagnosis in a few minutes and it costs you less money, you walk out happy, that doctor has more time to spend with that 70-year-old or 80-year-old in the next room who needs the extra time. So it's a complete win-win when we prepare ourselves, not just to improve our own healthcare, but to contribute to the strengthening of our healthcare system.
Absolutely. Yes. Now, in your opinion, what are some of the most important things that we all need to understand about the healthcare business?
The healthcare business is a caring, compassionate business. It is a business. I remember way back when I was in primary care, there was one period of time, one pay period, so to speak, that I couldn't pay myself. I had to pay my overhead, my employees and so forth. I worked harder for that 2-week period. I have so many bills, I didn't get a paycheck. And so it's the same for doctors and hospitals and any healthcare facility. If you cannot pay the bills, your doors don't stay open. And so we need to think of it along the lines of finding a happy medium where people get compassionate care, but it is done in such a way that the bills can be paid. Because usually when it comes down to it, hospitals are closing, doctors' offices are closing for that reason.
Interesting. And what would you say some of the what are some of the factors that say a doctor's faced with, needing to be more profitable? What are some of the factors when they're considering how to be more profitable that come into play?
Well, there are always going to be escalating expenses because your employees are regularly going to need a cost of living adjustment. They're going to be the malpractice issues. You've got to have to malpractice to widely stay in practice, the overhead in general, the price of goods, the price of gowns, the price of everything. It doesn't matter how much those things go up, you have to have them. And so the doctor's overhead can go up over and over, but the doctor has to be able to maintain costs. And so the insurance companies are not increasing what they're paying for the visitors, and the doctor's overhead continues to go up. And that is a very concerning issue. And so even getting back to the fact that if people are better prepared and they can go in and help the doctor, help them without spending a lot of time, without the need for frequent follow-up visits, then the doctor can get more people in, more new visits, and more complicated visits. And so it is a cycle. If we all do our part, we can strengthen our healthcare system. And it's a multifaceted approach that's going to be required because so much is needed. Between the doctors, they need to spend a lot of time on administrative issues, documenting in the electronic health record, in the record. And as I mentioned, they've got to document these different bullet points. They don't need to have 8 for every visit, but the doctors do need to be able to substantiate what they're doing, and based on the level that they're charging, different number of bullet points do need to be documented. So the more we can help each other, the better it will be.
Yes. Now, another really important topic you cover in your book is how to stay safe in hospital. So what exactly does this mean? And what do we need to be aware of as far as hospital stays go? And what can we do to stay safe?
Most of my medical career was spent as a hospitalist, and that means a physician, or it could be a nurse practitioner or a physician assistant who focuses on hospitalization. A lot of doctors, they don't go to the hospital after they leave the office anymore. It's a bit much. If you're in the ER, there's something bad that's going on, and the doctor has 10 people in the office, the ER calls, they can't leave those 10 people to go be at your bedside. And so there's a hospitalist movement. Hospitalists, they are very focused on the more acute, severe issues that cannot be addressed in the office, such as pneumonia with a low oxygen level, or other things, a possible heart attack, possible stroke, and so forth. And so it's very important for people to understand when you're in the hospital, while you need to be there, you need to make wise decisions. You need to partner in your care there as well. Let me give you some examples. A lot of people want to have a catheter in the bladder because they don't have to get up to go to the bathroom, and they don't feel that great, so they want to have the catheter in. The issue is the longer the catheter is in, the higher the likelihood that there is an infection in the bladder. Bladder infections will spill over into the bloodstream, and that can be fatal. When it's caught in time, it's typically treatable, but a lot of people die from urinary tract infections, and people don't realize that. If you're lying around the bed a lot because you don't want to get up and move around, you're at increased risk of developing a blood clot. The first sign of a blood clot could be a cardiac arrest. And so you may not know the body's developing a blood clot. The doctor may not know until the unfortunate sound goes up overhead, cold blue at 1:22. Signs of a blood clot, which are typical, from the start of the leg, or swelling, pain, redness in the leg. Sometimes you don't have any of those symptoms. And so if you get up and you move around, that will decrease your risk of a blood clot. Of course, that's based on the doctor clearing you to get up and walk around. So if you have something going on your doctor puts you on bed rest, don't push it. There are other ways to decrease your risk of a blood clot. And sometimes they are far better than walking around. You may be ordered an injection in your belly once or maybe twice a day. That would decrease your risk of blood clot. And a lot of people are like, I don't really want the shot, I'm okay. It is a significant cause of in-hospital. And so when you go to the hospital, you need to ask, what is the plan to decrease my risk of blood clots? If you are not ordered the injection, make sure you get up and walk around, that you have the clearance. And sometimes the doctors order pumps for your legs that will literally pump the blood back up to your heart to decrease your risk of blood clots. So that's one of the things you need to ask when you admit it. What's the plan so I don't get a blood clot? And again, lying in bed a lot increases your risk of bed sores. You get pneumonia. You need to try to keep your sleep-wake cycle as close to normalcy as possible. You don't want to sleep all the time during the day, and that might get sleep. So those are the sorts of things that are very important for people to realize that they need to take very seriously. Also, hand hygiene. If a person walks in your room and didn't wash their hands, it's not a doctor. You know, as a doctor, did you use the hand scrubber or something? Sometimes realistically, there is a sink and the doctor might wash his or her hands before coming in the room, but there is an issue with healthcare professionals not really washing their hands. And the hospital where I worked, and I suspect most of them will have a hand sanitizer on the wall inside the patient's room and outside the patient's room. So it's great if you can see that person coming in and using it at the same time. And don't be afraid to ask, did you clean your hands? And when your friends come to visit, your family members come to visit, they need to clean their hands too on the way in and out. The hospital is full of germs. You don't want your loved one to walk out with hospital-acquired germs on his or her hands and then eat or do something and end up with a bad infection. And if you're in the hospital, you could be more vulnerable. You don't want them bringing in germs either. So those are some of the most important things that people need to realize that they can do. And an IV, if you have one of the larger IVs, we call it central line, and it may be underneath your collarbone. There are other places, and that's a very common place where you'll see it. It needs to be clean. That is a significant way that bacteria get into your blood, and that can be fatal. Wow. And so you don't want to touch your IV tube. You want to have your hands clean. You don't want to be fidgeting with things. And so those, I would say, are the key elements that can help you decrease your risk of succumbing to something bad in hospital.
Thank you for sharing those. This is incredible. I feel like, why don't we all know? Like we should be given like a handout when we walk into the hospital with all this information. I mean, people are dying from, and I've seen it in friends, and I would assume, I'm not a doctor, but if somebody, like you said, got a bladder infection or a infection in a bed from a bed sore or from not cleaning their IV, that's more strong medication. And could that cause like in turn organ failure because you're on all this medication for whatever you're in there, plus now you've got this secondary infection from being at the hospital, now you're on more medication, there goes your kidneys.
And speaking of medication, if you get an infection, you're going to be on antibiotics. Antibiotics can increase your risk of a special kind of diarrhea called C. diff. If C. diff is severe, it can be life-threatening. It can cause septic shock. It can end up with you getting part of your colon removed and having to wear a bag. And you don't want antibiotics if you don't need them.
Right.
And as far as the kidney issues, yes, antibiotics and other drugs can cause kidney failure. So you want to be exposed to the fewest number of chemicals that you can be exposed to, And so it needs to be a partnership. We all need to be working together to decrease the chance of unnecessary infections and other issues.
And this is really great to hear this from a medical professional like yourself, who has been in the business for so long and serving patients. Because most of us, I feel like when we go to the hospital, we're at their mercy. Like, we're just kind of along for the ride and we have to do whatever they say. And we don't really have any say in any of it. It's just like, okay, they just do whatever they do and they're the professional.
That's a fear factor. And yes, physicians do know a whole lot more about why you're in the hospital than you do. And so when you're lying in the bed and you're scared, sometimes you don't ask questions, but it's okay to ask questions. If the nurse gives you medicine, why am I getting this medication? If you notice that there's a medication that you're taking and then 30 minutes later you develop a headache, tell the nurse. The doctor may be able to put you on something else, but don't just say, I'm not taking this. And so we need to be two partners. Another thing that is huge is having your own medical records. If you have an insurance company that gives you a portal and your employer changes insurance companies, you may not have that portal. So if you don't have your own copy of medical records, then that could cause a lot of issues as well. If you go to see a new doctor, your doctor is going to want to know what's going on. Not just, I have some kidney problem, or the doctor said I have something going on in my belly. The doctor wants to know specific diagnoses. Otherwise, you're going to end up with extra tests and procedures sometimes that you don't need. And so another thing that I talk about in Patient Empowerment 101, more than it's an adventure, is the significance of developing your own medical record. And just like I have the questionnaires, I have charts of the parts that you put in a medical record. They're in the book, and there's also information in the book about where you can go online within the Patient Empowerment 101.com site to download all these charts. So you can download them, fill them out, print them, and so forth. And I also did a companion book, Patient Empowerment 101 companion book. And that is a bound version where you can just fill in everything with your medications, your allergies, and so forth, and the symptoms questionnaires. All of that is just a bound version, and there's a little bit of motivation there as well. What am I going to do to empower myself? What am I going to do to empower others? And so after each of these things, then people have an option to jot down, what are you going to do differently? Is it, if you're going to empower somebody else, are you going to take the neighbor to her mammogram next week? Are you going to encourage your coworker to get a flu shot? What are you going to do for yourself? You're going to read a book, you're going to go to this website. And so it is a motivational guide and a health record all in one.
Oh, beautiful. This is incredible. And it makes a lot of sense, because if even if you're going from your primary care doctor to, let's say, a specialist, if you're not bringing along a full health medical record to even the specialist, they're kind of starting all over again.
You are, and you're going to sign a release of records. So the doctor can send your request to the other doctors and wait for them to send them back. And then you're going to have a follow-up visit. And you're going to have another copay, and you're going to prolong things. If you walk in the specialist office with everything he needs, you're going to expedite your care. So the Patient Empowerment 101 companion guide, again, that's bound. That's something that I recommend in the general book, and I walk you through that, is to get a 3-ring binder, go online, download all of these different charts I have. Get a package of tabs. I'll tell you what tabs you need. So you will have your own medical record. And the significance of having the 3-ring binder is when you go to the hospital, and you have the discharge summary, which is the summary, the type summary of everything that happened in your lab, x-rays, CAT scans, all of that, the specialist opinion. You need to get a copy of that, and you punch holes in it, and you put it in your medical record. You get the echocardiogram, DTH, all of those things. Excuse me. You put it in that 3-ring binder. So no matter where you go, if it's to the ER, to see a specialist or any place else you go to see a medical doctor, you will have a concise, organized copy of your medical records that the doctor can look through and see, okay, the kidney test showed the blood level was 1.1 3 months ago. Now it's 3. Oh my gosh. Or 3 months ago, it was 3.2. Now it's 3. Okay, so we're doing fine. So that's the sort of thing that helps minimize the excessive testing and procedures because you're empowered. You're empowered to partner with your healthcare on a level that will help expedite your care and just improve the healthcare system for everyone.
Right. So everywhere you go, every appointment, every test you get, you ask for a copy of the diagnosis of whatever test you have, and you keep that a copy for yourself each and every time.
Absolutely. And the cardiologist, I have quotes from a lot of different healthcare providers in the book. And there's a cardiologist whose advice was to snap a copy of your EKG and put it in your notes section of your phone. So everybody has to determine what they're willing to have on their smartphone. I would think if a thief steals your phone, looking at your EKG probably is not going to be a high priority. And so when they ask you EKG, what's it going to do with it? But you have to determine your level of comfort. So this cardiologist just recommends that because apparently there have been so many times that he's needed an EKG on a new patient or hospitalized patient. He didn't have it. Now, when you're talking about the fact that you could be having a heart attack, that's huge. And there are certain EKG findings that may be your quote unquote norm. But the doctor's not going to know that unless he has an EKG right there to compare it to. So if you go to the ER and you're having chest pain, and the ER doctor has to decide, is this person threatening a heart attack? If so, it can be fatal. Let me throw everything at the person to decrease the risk of a bad outcome. Very strong blood that can make you bleed internally. It can be serious, but the risk is better than taking the risk of letting the person pass away from a heart attack. If you pull out your EKG, whether it's on your smartphone or your own medical record, and the doctor says, hey, there's an abnormality that was there 3 years ago. There's no change. You can just save yourself an exposure. That's just one example of many.
Wow. So it can be absolutely life-saving. It can save time. It will save money.
And you might just be able to go home from the ER instead of being admitted to the hospital and running up a high hospital bill. So
Right.
The potential, it just keeps going and going and going. But we have to equip Americans with the tools. People, they can act, they can be their own best health advocate if you give them what they need to do those things.
Absolutely. And I'm so glad you wrote this book and have these resources to create that opportunity for people. Now speaking of medical bills, we need a lot of help with that in the US. We're the only country where there's a whole lot of bankruptcy because of medical bills. Are there any other ways, specific questions we should ask when it comes to billing when we're at the hospital, besides what we've talked about? That we need to know?
Excellent question. So people assume when they're put in the hospital, they are admitted to the hospital. You need to clarify your hospital status. You can go to the emergency room, perfect example. You go to the emergency room with chest pain, you're likely going to be put in the observation status. So you are sent from the ER, the hospitalist, or your doctor, if your doctor actually goes to the hospital, will write the orders, you'll get a bed, and you're going to get a lot of tests done. If you're under observation status, that means that your insurance company is not likely to pay anywhere near as much as if you are admitted to the hospital. If the tests show, okay, yes, there's a big concern about the potential heart attack. The stress test was abnormal. They have to receive a cardiac catheterization. Then the doctor can easily write the order to change you to an inpatient status, so to speak. But it goes beyond the doctor just saying, okay, you're a nice guy. Let me make you inpatient. the insurance company can say, we're not paying for anything. This is an observation patient. If you wanted to bill for the inpatient status, and the national guidelines state that the member did not have enough concerning features to really reach that level of care, and you discharge the patient, and then later on you bill us, you don't reach that level of care. Based on the contract, they may or may not pay for observation status. They may say, we're not going to pay anything. Even if you get the observation, if the observation status is paid for, you may still end up paying for your medication, for your IV fluids, for all sorts of things. And so if you know your level, you can ask the doctor, what can I do to lower my bill? And it might be, the doctor may say, you can take the medication that you have in your purse, but we need to supervise that. So you may not have to pay for that hospital medicine, but never, ever, ever take your own medication just because you want to lower your bill. So that can be extremely hazardous. Your doctor and nurse, everybody on your case needs to know exactly what you're taking. If they would document in the record, the patient can take her own blood pressure pill, and the nurse sees, okay, you took the blood pressure pill, and it's documented. So it has to be a partnership. The doctor may also choose not to order something that is not vital and say, your doctor did order it as a follow-up, issue. And so when you're on observation status, instead of ordering tests A, B, C, D, and E, because this is a little bit abnormal, let me look into this. If you let the doctor know, I would like to focus on what we really need to do and just write everything else you think needs to be done in my discharge summary, and my doctor can follow it up as an outpatient. The doctor may say, okay, you have anemia, but if you're not obviously bleeding, I'm not going to order all these iron studies. I don't need to order all these things. Let your doctor do it. So know your status and just let the doctor know that you have concerns. And also, when it comes to medications, a lot of medications are available for $4. There are $4 plans. Just Google $4 prescription plans. And I'm not going to tell you the pharmacies that we know do this, and they're fine. Personally, I'm not going to pay full price for a drug if I don't need to, because you cannot get the generic approval if you can't prove to the FDA that it is safe and effective. So when I get medications, yes, we need the generic. I don't see the point in paying for the full price. So particularly if you are uninsured or you have to pay a lot out of pocket for medications, tell the doctor, if there is a comparable generic equivalent, could you please write that for me so I can go to a pharmacy and get a 90-day supply for $10 or a 30-day supply for $4, or you can Google drug savings cards, the variety of those. And I don't mind admitting I use them. Why pay more? What's the point? You get the exact same thing. You pull out your drug savings card and you keep 30 extra bucks in your pocket. So yes, there are definitely things you can do.
Wow, that's incredible information. Yeah, the drug. So these are off brand names. They're the same drug, they're just not the brand name drug.
Exactly. It's kind of like different types of peanut butter.
Right.
You have brand name, you have the store brand. If they taste the same, why are you paying double the price? You're paying for the advertisement. So with the brand name, you're paying for the millions of dollars and years that went into the research and development.
Right.
So after so many years, that drug can lose its patent and other people can create that drug. But it's the same drug. So every now and then there are going to be issues where a person may not respond quite as well, and they may ask the doctor, hey, I like the brand name. Those things do happen, but most of the time you're going to find that you have a drug.
So this is a step further than just going to your regular Walgreens or CVS pharmacy and getting a non-brand name generic version. There's actually different pharmacies or places to purchase these much, much cheaper. You said $4 drugs.
Yes, just Google $4 prescription plan. And honestly, some of the very commonly used places have it.
Mm.
You can look and you can often download, you can see what drugs are on the plan. Not all drugs are.
Right.
And so what you might want to do if you go to Pharmacy X is on the corner and they have a $4 prescription plan and you have high blood pressure and you want to download that and take a copy with you to your doctor and say, I want this $4 per month plan. Is there any drug on here that's comparable to what I'm taking? You'll say yes or no.
Mm.
Sometimes it is a seamless transition. Other times it's not. Other times there are specific drugs the doctors want to use. But if you have the potential to save the ton of money, doesn't hurt to ask.
Absolutely. Thanks for sharing that. That's some good information for all of us. Now, from my observation, from a lot of things you're saying, it sounds like insurance companies create, I would say, I don't know, maybe higher prices in a way, or major constraints on doctors as far as their work goes. So there, it sounds like you have, from what you described earlier, your hands are kind of tied in certain ways, and you have to produce a whole lot of information in order to get certain clearance on payouts from insurance companies. Additionally, I feel like a lot of, you know, the patients, it's such a complicated, insurance plans are so complicated and hard to understand too. So it's kind of this extra layer to healthcare on both sides, patients and doctors, that kind of makes everything more difficult.
Well, actually, we've always wanted to know these things. So these 8 elements, the severity, you go to the doctor says, how bad is the pain? That's the severity. Or does it hurt? That's the location. So these are things that we've been doing for decades. The issue is there have been people, maybe a lot of people over time who have just charged too much. People see the doctor, I can't believe they charged me all this money for 5 minutes. And so it's a matter of reining in costs. Yes, patients have different complexities, but there has to be a way just to make sure that everything is kept on the up and up. If you don't want to charge the patient an exorbitant amount, you only got a little bit of data. And so it protects patients, it protects the healthcare system. And we want to know this anyway, because if you tell me the severity of the location, what makes it better, or so forth, that helps me figure out what's going on. And
Right.
so this is something old hat for us. It's just something that the public really is not fully aware of what's going on behind the scenes, and it helps them because it helps the doctor help them quicker. And when they think about these things before they see the doctor, they don't have to sit on the exam room table and take 3 times as much time to think through these things.
Right.
And that means that they can get out quicker and they can likely get the diagnosis right early.
So important. Now, in your opinion, what are some of the factors we need to think about to choose the right doctor for us?
The doctor who's perfect for your spouse may not be the doctor perfect for you. You have to determine what matters. For instance, if you work on the other side of town and you prefer to go to the doctor after hours, then you're looking for a doctor near where you work who has evening hours. If you prefer a woman or a man, whatever the case may be, you have to determine what really matters to you. Evening, weekend hours. Does the doctor have televisits? Is that important to you? Does the doctor let you make your appointments online if you want to? Can you communicate through a portal? All of those things are important. So you need to determine what matters to you.
Right.
And once you prioritize what matters to you, and you ask around, who do you see or who do you see? And how much you like that doctor? You can go online and research the doctors. A lot of insurance companies have a panel of providers. So you want to see who is covered under the panel. So you don't have to pay extra to see the doctor. So once you see who is in the panel, in network, so to speak, and you get recommendations. You can go online to the state medical board to research the doctor. In the book, I give information, specific information, like a site that you can go to that you can look for board certification. So there's a chapter in the book about basically choosing the right healthcare provider. And so there are several steps, and it's okay if you're not happy the first time. You can find another doctor. You get a second opinion, a third one if you want to, because you're looking for somebody you feel comfortable with. Does that person listen to you? Are you able to get out what you want to get out? But keep in mind, that the more concise you are, the better. Because no matter who it is, the doctor may have 5, 6, 7 more people scheduled in the next couple of hours. So you do your part, but you want somebody who makes you feel respected, who listens to you, whom you can get in to see. If the doctor doesn't have a follow-up appointment for 3 months, you get an acute bronchitis, that may not be the best for you. But as we mentioned, the healthcare system is looking at a huge shortage. And so that should not be the only factor. So basically, you go and you're interviewing that doctor. And if it doesn't work, then you can redo your list and see who's second on your list. You can go back to the drawing table. But you want to partner, somebody you can partner with. Think of this person as kind of like a friend that you can feel comfortable with and that obviously values you and what matters to you.
I love this mindset that you've created around this. It's the questions that you were, or the tips that you were listing. They seem simple, but I was thinking, wow, those are things, you don't really sit down and think about when choosing a doctor, which are really important to think about when choosing a doctor. So yeah. So thank you for that chapter. Your book is just full of so much great information. And speaking of which, for those who want to contact you, where can we find you and your book? I see it there behind you on your desk. And can you tell us about all the other great resources? I know you've mentioned some throughout the show that we could all check out.
So the main website is patientempowerment101.com. This is the book. And if you just put in Patient Empowerment 101, Amazon, since it's a new book, may give you a little bit of grief finding it. So put in Patient Empowerment more than a 101, more than a book, it's an adventure. My name is Hester, Ann M. Hester, MD. You put that in, then you can get the book to come up, and also the companion book will come up if you put in the companion book. But if you go to the main website, you can read some quotes that some healthcare professionals have said, a cardiologist, an internal medicine doctor, an ER provider. There are several reviews. ReadSee, the San Francisco Review of Books, online book club. They all gave it 5-star reviews. So you can read about that. Also, on that page there is a free download, so you can download a free My Mini Medical Record form, and you can fill it out and keep it in your purse. And you can, something else I didn't mention, within the site itself, there are little cute quizzes you can take after you've read a chapter, real-time quizzes. There are little videos, little cartoon-like doctors giving you more empowerment tips. But on the main site, there's a form you can fill out about, do you want information about being updated? And you can just fill it out. And if you want to ask a question, you can fill it out there. The book is available on Amazon, also on Barnes & Noble. Either of them certainly you can order online. If you go to your Barnes & Noble and you ask them to order it, they can certainly do so. It's in their system. It's soon going to be rolled out to other bookstores as well. But right now, Amazon.com and Barnes & Noble are the ways to go about getting the book.
Beautiful. Thank you for sharing. Well, I will post links to all your sites and to your book for those that want to contact you below. And thank you so much for joining us today and really sharing these amazing practical tips and strategies that we can all use to take control of our own health and our health care and really become equal partners with our doctors. And thank you as well for all the work you're doing
I
with your
appreciate
books and your resources you've created. They're really incredible.
I did forget, just recently started a blog, Patient Empowerment 101.blog. And so over time, there'll be more and more articles that people can access that will give them more and more tips.
Beautiful. We'll post that below too. We love blogs. Before we wrap it up today, do you have any final thoughts around the importance of taking control of our own healthcare?
Yes, we are facing a potential tsunami in our healthcare system. You don't have to be a doctor or a nurse. Play an active role in preserving our healthcare system and making it stronger. And so whether you get the book, if you just go to the blog and read up on topics, please learn all that you can learn about empowering yourself and teach others, because if we all work together, we're going to be stronger and more able to withstand this coming tidal wave that's coming to our shores. So thank you so very much for your time. I really appreciate it. And go out and get empowered.
Thank you, Dr. Hester. Remember, knowledge is power. The more you understand about your body, the better you're able to stay healthy and prevent disease. And a reminder, I'm not your doctor, so please don't take this as medical advice. If you have specific questions about your healthcare, feel free to reach out to your practitioner. And if you like this video, please like and share with others. This information could really help someone you may know. And if you haven't already, hit that subscribe button below to be sure you don't miss out on our future shows. And I will see you all next Wednesday on the next episode of Discovering True Health.